Several structures in the brain connect corresponding portions of the right and left hemispheres. The largest of these commissural pathways is the corpus callosum, indicated here. This structure, running in the anterior wall of the third ventricle, is the anterior commissure. And this small structure, connecting the right and left hemispheres just anterior to the pineal gland, is the posterior commissure. Cingulate sulcus, outlined here, separates the cingulate gyrus and subcallosal area of limbic lobe from the superior frontal gyrus of the frontal lobe. The arrowhead points to the pineal gland. This dashed line points out the columns and the body of the fornix. And this green shading illustrates the third ventricle, which has its anterior extent going between the right and left columns of fornix. Here we have added in the fourth ventricle, and the third and fourth ventricle connect through the cerebral aqueduct, the smallest portion of the ventricle system. This arrow points out the mammillary bodies, which are paired round structures in the roof of the interpeduncular cistern. And here we point out the interpeduncular cistern. This midline structure that extends from hypothalamus to insert on the pituitary gland is the infundibulum. And this is the pituitary gland within the sella turcica. This structure is the midbrain, and this is the belly of the pons, which contains many fibers from the middle cerebellar peduncles. This structure is the medulla. The upper arrow is the primary fissure of cerebellum that separates the anterior and posterior lobes of cerebellum, and the lower arrow points out the tonsil of cerebellum. This arrow points out the obex, which is the entrance to the central canal of the spinal cord. Moving off midline, we can see the mammillary body and also the column and body of fornix with which it connects. This structure is the optic chiasm, and this bright white structure is the anterior cerebral artery, which courses very near the optic chiasm. This arrow points out the exit of the third or oculomotor nerve from the interpeduncular cistern. These arrows point out the superior and inferior colliculi. Moving a little more laterally, we can again trace the optic tract and again see the oculomotor nerve, the third nerve, heading from the interpeduncular cistern toward the cavernous sinus. And we can again see the body of the fornix. This arrow is the medial aspect of the head of caudate nucleus coming into view. This arrow indicates the superior cerebellar peduncle. Moving farther laterally, we can see the optic tract making its way toward the lateral geniculate ganglion, which is part of thalamus, This more posterior arrow is on the pulvinar of thalamus. This arrow shows us a little bit more of head of caudate nucleus. This arrow indicates the posterior communicating artery, which is in close proximity to the course of the oculomotor or third nerve. This large white structure is the internal carotid artery. This broad band of tissue is the middle cerebellar peduncle, and we can see that very nicely also on the axial images. This dashed line indicates the parieto-occipital sulcus that separates the cuneus, indicated in purple, of the occipital lobe from the precuneus, indicated in green, of the parietal lobe. In turn, the precuneus is separated by the marginal branch of the cingulate sulcus from the paracentral lobule, which is part parietal and part frontal, and is divided at the vertex by the central sulcus. Stepping laterally, we can still see the cuneus gyrus of the occipital lobe, and the red line indicates the calcarine sulcus that has visual cortex within it, and that sulcus separates the cuneus gyrus of occipital lobe from the lingual gyrus of occipital lobe, here indicated in yellow. The more anterior arrow is on the head and body of caudate nucleus, which continue to indent the lateral ventricle. The second arrow, more posteriorly, indicates the splenium of corpus callosum. This arrow indicates the portion of cingulate gyrus just beneath splenium, and this is called the isthmus of the cingulate gyrus. Farther anteriorly, this gyrus changes its name and is known as the parahippocampal gyrus. This arrow indicates the most medial portion of the uncus. As we move farther laterally, we can see more of the uncus, here indicated in green. This red line indicates the lateral fissure, and it separates the frontal lobe from the temporal lobe. Notice there is a blood vessel, indicated in white, that separates these portions of the brain. That is the middle cerebral artery, indicated here with an arrow. This arrow indicates the lateral portion of the middle cerebellar peduncle, and this structure extending from the anterolateral pons is the trigeminal nerve, and the arrow in front of that indicates the fluid-filled Meckel's cave into which the trigeminal nerve extends. Once again, we see portion of the body of caudate nucleus indenting the lateral ventricle. Parahippocampal gyrus bends back on itself and forms the characteristic configuration of the uncus. The anterior putamen is indicated by this arrow, and it is separated from the head and body of caudate nucleus by the anterior limb of internal capsule. And here we can see more of the body of the caudate nucleus. This arrow indicates the crus of the fornix. This material within the atrium of the lateral ventricle represents choroid plexus, which produces CSF. This is the small flocculonodular lobe of the cerebellum. Again, we can see choroid plexus, which produces CSF within the atrium of the lateral ventricle. This arrow points out the crus of fornix, and this arrow points out the curve of the internal carotid artery as it enters the skull base. The large dentate gyrus of hippocampus becomes visible farther laterally as we move into the temporal horn of lateral ventricle. And speaking of the temporal lobe, this is the superior temporal gyrus, the middle temporal gyrus, and the inferior temporal gyrus. The arrow above, again on the dentate gyrus of the hippocampal formation, and the lower arrow is on the cervical portion of the internal carotid artery. A very faint streak of white matter is visible, and this is the fimbria of fornix that arise as efferent fibers from the dentate gyrus of hippocampus. The hippocampus is outlined by dark CSF in the temporal horn of the lateral ventricle. This dotted line represents large stretches of uninterrupted association fibers in the cerebral hemisphere. As we continue laterally, a separation between the temporal lobe and the frontal lobes comes into view. This is the lateral sulcus, and we can identify portions of the inferior frontal gyrus, the pars orbitalis indicated here, the pars triangularis indicated here, and the pars opercularis indicated here. At the top, we can see a portion of the central sulcus. The intraparietal sulcus indicated here separates the superior and inferior parietal lobules. A portion of the precuneus gyrus we saw earlier extends up and over the top surface and is indicated here with the green shading. Continuing farther laterally, we can again see the lateral sulcus, sometimes called the Sylvian fissure. Separation between the frontal and temporal lobes is defined by the lateral sulcus, and it is capped by the supramarginal gyrus. The superior temporal sulcus, in turn, is capped by the angular gyrus, and together the supramarginal gyrus and the angular gyrus comprise the inferior parietal lobule, and the inferior parietal lobule is separated from the superior parietal lobule by the intraparietal sulcus.